Houston Heart Institute provides interventional, non-interventional, and cardiac rehab services. So we do diagnostic heart caths, interventional heart caths, and all of the non-interventional cardiac testing. In the interventional department, we do those types of procedures that we have to actually put catheters, wires, and stents inside your body. And we will do those things in a very sterile environment. In non-invasive cardiology, we will do those procedures that do not require those things, such as stress testing, echocardiograms, transesophageal cardiograms. A diagnostic heart cath is a procedure that we perform when your physician feels like there's a possibility that there's a problem. We will not do a diagnostic heart cath as a first line. It's typically only done after an EKG change is detected. A patient has had chest pain. Typically, a patient will go to non-invasive cardiology for stress testing and echocardiograms, that kind of thing, prior to coming to the cath lab for a diagnostic heart cath. The reason for that is the other non-interventional testing is not conclusive. It's very good information and it's very good test, but it's not definitive. If those tests indicate strongly enough that there's a possibility of a blocked artery inside your heart, your doctor would schedule a diagnostic heart cath where we will determine whether or not there is a real problem. Another service we provide is electrophysiology. That's a new service for us. We've been performing that procedure for about a year now. And with that test, we diagnose and treat arrhythmias such as atrial fibrillation, which is a very common problem in the population. And we now can diagnose and treat those in our electrophysiology department. Health Connections is the cardiac rehab branch of Houston Heart Institute. And we send patients to cardiac rehab after they've gotten a stent, or if we have to send patients for bypass surgery. And it's beneficial because we get an idea of their beginning tolerance for exercise, and we put them through a regimen of exercise for a period of time, monitored by a nursing staff and a staff of trainers. And their progress is measured, and it improves their level of functioning. These blockages don't typically crop up overnight. It typically takes about 10 years before it gets to the point where it can cause a problem. We can see changes taking place. We can monitor lab work to then identify things that put you at high risk. We can monitor for EKG changes. There's a lot of things we can do in advance, to identify that kind of thing. But once it gets to the point to where you're actually having chest pain, it has been going on for quite a while. It's very difficult to explain the significance of the program that we have at Houston Heart Institute, but the analogy that I frequently use is that of a firehouse. If your house is on fire, do you want a fire truck coming from the same county or from 3 counties over? The answer is you'd like the fire truck to come from across the street. It's an accurate analogy when it comes to the services that we provide. If you are experiencing the signs and symptoms of a heart attack, it's comforting to know that we have a very capable staff and a state-of-the-art, brand new facility at Houston Heart Institute to address those issues.